Welcome to the Forging Wellness Podcast, where we go beyond the basics of health and wellness to build stronger minds, bodies, and communities. I'm your host, Jesse Clark, a firefighter, paramedic, and coach with 19 years as a first responder. I have a passion for this job, for my family, and for truly enjoying life. But I'll be the first to admit I haven't always gotten it right. I've had my ups and downs, made mistakes, and learned some lessons the hard way. But that's what this podcast is all about, learning, growing, and forging a better path together. We're diving into mental and physical health, fitness, nutrition, sleep, leadership, real-world challenges, history, and what it truly takes to thrive. Whether you're a current first responder, aspiring to be one, retired, or the spouse of one, this is for you. Life is more than just making it through the day. Let's forge ahead together. Now let's get into it. All right. Welcome back to Forging Wellness Podcast. This is episode number 5 of season 2. Today with us, I'm super excited to have Lyndsy Kinghorn, founder of Foundation Functional Medicine. She is dual board certified Family and Anti-Aging Nurse Practitioner. She is a former emergency department RN, an athlete, and a health optimization specialist. Today, we're going to go over her journey from frustration with conventional medicine to functional medicine and performance-based healthcare. Lyndsy, welcome. Thank you so much for joining me. Why don't you give us a quick introduction?
Yeah, thanks so much for having me. I'm excited to be here. So, as you said, I'm Lyndsy Kinghorn. I opened up Foundation Functional Medicine just under 5 years ago. I was actually an ER nurse and nurse practitioner for, close to 15 years combined before I stepped into the functional space. But I care for people in the Treasure Valley. I love working with first responders. We also are licensed in multiple states, and I have a great team of experts that work with me in this space to help people really optimize their health.
We'll just jump right in. You said you're licensed in multiple states, and something that people see if they look at your website will be that you basically have a mobile clinic. Is that
Yeah,
why you got licensed in multiple states?
not necessarily. Well, I'm from South Dakota originally, and so I had a population of patients out there anyway, so I kept both states, and then you start seeing people, and they're like, "Can you see my mom that lives in Washington? Can you see my, sibling in Montana?" And so I have just kind of opened up that ability by licensing in other states. However, I did build out our Lux is her name, our Sprinter van, our concierge mobile option, honestly, more for people like myself who don't love going to an office and like to be on the trails or living a busy lifestyle to go to them. I will travel to other states if it makes sense for me and the patient, though.
Okay, very cool.
Yeah.
So 15 years of experience in kind of your standard medicine that we see in the United States in the emergency department as a nurse and a nurse practitioner. That's a lot of schooling, that's a lot of experience, and that's a lot of trying to help people and feeling that you are trying to do the right thing for people. I'm not taking anything away from emergency rooms and what they do because obviously they save lives. But I do know, speaking from the paramedic standpoint and an athlete standpoint or a coach standpoint, we see both sides of the spectrum there because we see people coming into the emergency department who sometimes doesn't feel like they actually want to take care of themselves or take the advice sometimes. But then on the athlete side or the coach's side, it's encouraging, uplifting because you got people in there who are wanting to better themselves, potentially wanting to, not have to be on medicine, not have to be on all the things to make themselves better. So you've experienced both sides of that.
Hmm.
But what led you to feel like maybe this just really isn't the right course and you wanted to make that shift?
Yeah, thanks for asking. I agree with you, actually. I think emergency medicine is very important and life saving for many people. My own journey to functional medicine was because of my own health journey. And I think a lot of us in the space find functional medicine because of that. We can get into my more personal journey, but I was working swing shift as a nurse practitioner. I was a very competitive CrossFit athlete, thought I was doing all the right things, but started to have some new unwanted symptoms. I was in my late 20s, early 30s. And I was like, I shouldn't be having these hormonal changes and my libido shouldn't be low and my mood shouldn't be all over the place. Like I'm doing everything right. And not from an ER standpoint, but from my conventional colleagues, the answer was pretty much nothing. Like your labs look fine. Here's an antidepressant. And that's where I was like, man, there's got to be something more. Like, this isn't prescription, right? This isn't just a symptom. Like, there's something that is driving this. And so I started looking into alternative care, functional medicine. Honestly, as an ER nurse and NP, some of me was like, this is a little woo woo until I experienced it. And so that was really led me into functional medicine. I stepped into that space in my first visit and I was like, oh my gosh, like, duh, this is how I want to treat people and how we should be preventing and optimizing people.
Okay. Because I have to imagine you said that they prescribed you an antidepressant. And even though you're feeling fatigued and maybe have some of these hormonal things that you talked about, you probably didn't necessarily feel depressed overall. Like it didn't fit. And that's something that we deal with in the first responder space because PTSD is such a big diagnosis but not everybody fits in that box of PTSD, and it has driven some people just absolutely insane because they're like, sure, I get that maybe there's something that fits into that category, but that's not me as a whole. Does that sound kind of an accurate for you as well?
Yeah, I mean, I didn't take the prescription because I was like, I'm not depressed and that you're
Yeah.
not seeing me as an individual. And I think that's where, and maybe not any fault to their own, but the conventional medicine isn't individualized or personalized medicine. It is, here is a prescription for your symptom. Hope it helps, as opposed to treating the individual and uncovering what might be causing the symptoms.
Yeah, so you basically said you walked in, tried functional medicine, you're like, kind of had it like an aha moment that this is it. What was that aha moment? What was so different about it that kind of gave that to you?
Yeah, I mean, I say I drank the Kool-Aid. You'll get that from the CrossFit world, but I was all in the first visit. For me, it was just more, I mean, just the questions in general. I spent almost an hour and a half in that first visit with practitioner, which I'd never done, right? You wait in a room for 30 minutes, you see a doc for 5, 10 minutes, and then they're out of the room. And so we really dug into my lifestyle. Truly, now I look back and I'm like, duh, I was pushing myself to the limits and not recovering, under eating, over exercising, had a very stressful job, sleep was off, like all the things that you guys experience. So for me, it was like, oh, yeah, it's so easy to uncover those things when you have that conversation, that time to spend with somebody. Of course, we did much more than just converse. We did some testing, but that was the moment where I was like, this makes sense. This is the lifestyle piece that's been missing, not just prescription to manage my symptoms.
Okay. So part of this podcast and what Forging Wellness is making sure that first responders thrive throughout a long career.
Mhm.
And what I've seen just in the short time of doing this and in my own journey is something that I think resonates with you that I got from your website is chasing quick fixes just isn't beneficial to that thriving for long term. It might make short term here and there better, but so what does it mean to play the long health game?
Yeah, I mean, I think the long health game is the best option in terms of just optimizing your health and that longevity piece. We're in a society of quick fixes. Amazon's delivering the same stinking day here in Boise. You go to a provider and they're just going to give you a prescription. That's how they've been trained. So it is a little bit more maybe frustrating for people, but truly it uncovers then root cause. Really lifestyle. I talk about this all the time. Even in the functional space, like there's so much cool things we can do. We can do really comprehensive testing. I can spend a bunch of somebody's money and really uncover any exposures, look at their hormones, cortisol, stool, breath, all the things. But if we haven't dug into lifestyle foundational pieces, how are you sleeping? What are your relationships like? What is your food and nutrition? Do you move your body? All those things. What are your previous traumas? Like none of that stuff is really important. And that is where you really have to make the shift. And that can take time, right? For that body to see the response from making those lifestyle modifications.
Okay. And you have a bunch of different facets to the foundation functional medicine. A lot of practitioners in different areas. You have physical coaches, you have nutrition coaches, you have some mobility coaches or practitioners, but you specialize in gut health. Why do you feel like that is kind of the root of all things?
Yeah, everything starts in the gut. I mean, I think we see that more and more, even in the literature today, and I think that's become more hot. But if we think about the gut, I mean, they even say it's a second brain, but so much of our, well, nutrition, for one, we could start there, just the way we absorb food that we eat. obviously comes from the gut. If we're eating food not absorbing, makes a huge impact. We detoxify our hormones through the gut. Immune system, most of our immune system is housed in the GI tract. A lot of our happy hormone serotonin is made in the GI tract. If this part of the body is not optimized, no other portion will be. Sure, we can throw on some hormones, give you some testosterone, help with your cortisol. But if the gut isn't optimized, all those things will hit a ceiling. We won't be able to move the needle like we'd want to.
So then where do you start with most people that come in to see you? And this is something because a lot of first responders, firefighters specific, have low T because our sleep is absolutely terrible. But what's kind of the first thing that you do for most people when they come in and see you?
Yeah, so it's a lot about the intake. This is where it's not the cool or sexy thing. It's not the cool test or the prescription per se, but it is like diving deep with people, learning about what they do for a living. Are you a first responder? What is your sleep like? Do you work night shift and sleep during the day? Home stressors, all of that stuff, we uncover that. And then I definitely dig into hormones because that's top of mind for a lot of people. That includes reproductive hormones, cortisol, insulin, and thyroid, of course. And then I'm always talking to them about their gut health, nutrition. A lot of people feel that maybe constipation or going to the bathroom twice a week is normal, or having diarrhea every day is normal. It's just what they've always had. That stuff isn't normal, right? So really getting into the nitty gritty of their symptoms and not just accepting like normal as an answer. But that we really deep dive in that first visit. And then if I feel, which I do almost on everybody, that gut needs some work, that's where we start.
Okay. This is super interesting to me for two reasons. Because one, a big thing that's kind of come around recently is peptides.
Mm-hmm.
And BPC 157 is a big peptide, and it has to do with the gut.
Mm-hmm.
Because it's something that basically our body already does naturally to repair our muscles, tendons, ligaments. It helps with that.
Mm-hmm.
The other thing that I find extremely interesting about this is we're so used to saying we have our emotional responses, our fight or flight, and then on the flip side, our rest and digest, right?
Mm-hmm.
And when I did a deep dive into that, it was pretty eye opening to me because as first responders, we end up short circuiting that system quite often. We go to fight and flight real easy and often, but because we're so good at like, okay, well, we've done this before, our brain is able or our body is able to short circuit that, and we never fully get into that rest and digest phase. Can you speak to how that might kind of throw us off?
Absolutely. I think first responders for sure, and even kind of like different aspects of healthcare. But I just think general population, we're kind of always in this fight or flight right now. I think very uncommon to actually spend much of our time in the parasympathetic nervous system. The body is made to protect itself in that way. We think about like ancestors, right? We have this sympathetic nervous system. In their case, you were being chased by a lion. Maybe in your case, you were showing up to a terrible scene and you are kicking in to be able to manage a situation, help people, save a life in that situation. So that is a good thing. We want cortisol. We want to utilize our glucose. We want that thing to work really
Right.
well. But it is the other point where we're like, okay, that is over. We're driving back to the station and now we should like be in that rest and digest. That never happens because there's always something else going on. Either our body doesn't even know how to shift back into that, or we're constantly bombarded with other stressors, just life stressors, work stressors, social media, whatever that is. And we never get into that parasympathetic rest and digest. For that reason, the body stays in like, I am in fight or flight survival mode. When we're there, it doesn't care about digestion. It sure doesn't care about reproduction. So hormonal health is going to be in the tank. Those are two really important things for people. So we're going to disrupt our gut and hormones will definitely be imbalanced if we can't focus more. And sometimes that has to be very intentional, especially in the line of work that you guys are in. We talked about this a little bit in the intro. We can talk about heart math or other mindful things that we can do to make sure we're getting back there and knowing what it feels like to actually be in rest and digest, because I don't think many people do.
Yeah, absolutely. You would assume that when you sit back and relax in the chair or you sit down for dinner or after dinner, that that potentially just naturally happens. But the reality is it doesn't, right? I agree with you. I think this is a nationwide, cultural, normal human being problem to have, not just first responders, but especially for first responders. Even if we get that chance to sit down in the chair or whatever, we're always ready for that next call to drop. We're always on edge a little bit that it's going to happen. So it never fully shuts off.
Right, exactly.
Okay. What are some common signs that you see in general? I know it's probably different for everybody, but common signs of gut dysfunction that people typically overlook.
Yeah, so I think people often think like, I don't have diarrhea, I don't have constipation, or I'm not bloated. I actually love when somebody comes to me and they're like, my hormones are off for sure. Like my energy's poor, my hunger cues are off, my libido's down, I just don't have stamina anymore. It's got to be my hormones. And I'm like, I actually think it's your gut. Or I've been dealing with this skin rash forever. Like it's just a sign that something is there is dysfunction somewhere, right? This is why I'm always a gut first practitioner. It is amazing to me. I see a lot of patients for gut health, of course. I get patients in my office who can't be away from a bathroom because they don't know when they're going to need it. They have chronic diarrhea. We fix their gut. And the first thing they tell me is like, oh my gosh, my energy is so much better. I'm sleeping better. My mood is stable. Well, yeah, I haven't had diarrhea in 2 weeks. I'm like, whoa, whoa, whoa. That
Yeah.
is your least of your worries when that was the reason you came to me. So all those things that we don't correlate really are so impacted by the way we absorb nutrients, the way we detox, all of the things.
And that's so funny because that is such an overlooked thing, probably because when you feel like that has become your natural state, how much does that limit what you typically do?
Hmm.
I'm just picturing what you're talking about and thinking about somebody who's like, well, I don't know that I can be that far from a bathroom. So I'm probably not going to go for that long bike ride that I used to do. Or, long camping days aren't going to be that exciting, or river
Right.
trips. So it all changes. And then all of a sudden, that goes back to normal. And now you can potentially just start enjoying life again.
Percent. I know. It's like, well, let's remember why you came in. Like, you actually can go do whatever you want without worrying about literally having a diarrhea in wherever. But I do love that the side benefits are so paramount for people. That's the first thing they bring up. It's so cool.
Okay. So you talked about what you typically do for assessment and deep dive, potentially getting into tests, but where does somebody start like healing their?
So a lot of that is exposures. So what got us to the point where we are disrupted? I unfortunately say this often, but we're all fighting for our health in today's day and age, what we're exposed to in our food, in our water, and the environment. It's just unfortunate. So people have a misconception of what they think is like healthy. I know I did when I was in the bodybuilding space, even like low fat, fat free things, all that stuff was so great, but really it's just a bunch of fillers. So really diving into like what they're putting in their body, if they can afford organic or not, can we do some things organic? And then truly even just like how you eat your food. I have had actually multiple patients in my office who have had, multiple colonoscopies or endoscopies, have been on PPIs, all these different meds because they have all these symptoms. And I change the way they eat and they get better. None of us, as we go back to that parasympathetic, sympathetic nervous system, we're never in that rest and digest. The body's never prepared for food because we're eating on the go or watching TV or waiting for the next call to come in. We don't chew our food, all the things that make a huge impact. That's where I start. And then it is like, do we need to do testing? Are we concerned about a dysbiosis? Is there a bacterial overgrowth? We can do that cool testing to mitigate those. But the foundational things, again, not sexy or cool, are the most important long term.
Okay. Yeah. So I'm going to look something up here with that. Something that I found really interesting once. Yeah, it's Aubrey Marcus.
Hmm. Hmm.
I'm
I've heard
sure.
of him. Yeah.
Okay.
Yeah.
He started the supplement company on it, but
Hmm.
he also wrote a book, and it's a really good book because he does dive into the fact that we've been misled in thinking that some of the things that we think of today as being unhealthy. Milk was a really good example of one that he brought up in his book, is that we're so scared of like whole milk because of the high fat, right? But really it's more the pasteurization and the homogenization of that has actually made that a bad thing for us. And actually that high fat can be good. Now, I'm not saying that's all we should have. Obviously,
Right.
everything in moderation. But would you agree with kind of that take on some of that?
Oh, yeah, and actually, I mean, fat got villainized. I think we're the similar age, but it was fat-free everything when I was growing up in the 80s, right? Fat was the bad, and I think that always comes and goes, but really just whole food in its natural state is the best. Fat is very, very important, and cholesterol is very, very important for hormonal health. So it should not be villainized. But yeah, that sentiment is very true. We've been maybe misled some for sure.
Okay. So I don't know. I've heard the term a number of times, is leaky gut. Is that something that is real? Is that something that we should care about? And why should we care about it?
Yeah, so leaky gut is a term that you hear often. It is actually like real. I think when people think of leaky gut, they're like, I have, a chicken wing floating in and out of my gut, because there's no barrier. That's actually not how it works, but it is due to inflammation. I would say a large percentage, if not everybody, has some sort of leaky gut, again, just due to our exposures. But anybody that walks into my office, I assume, has some sort of leaky gut. We can test that. There are tests for leaky gut. I treat everybody as such. We have a very thin gut lining, just one cell layer thick. And so when we get maybe an infection, or we're taking a bunch of anti-inflammatories because we hurt our knee, whatever that looks like, we do cause inflammation, and that can break down that gut barrier. How do we fix that? Oftentimes we remove some inflammatory foods, obviously working on, how we eat, again, going back to that, how we chew our food, sitting down to eat parasympathetic. And then I'll use, a lot of good herbs to help kind of heal and seal the gut, which can make a huge impact on people's lives. I see how people might know they have leaky gut, or be concerned about it, is if they have a ton of food allergies, never had food allergies, and now they're not tolerating any foods at all because the body is so inflamed, it's reacting to everything we eat.
Okay. So let's shift gears here slightly and go back more to the athletic slash first responder space. Well, we never really left it, but those people push their bodies potentially harder than most. And you've already spoken to this a little bit, but what are some of the big mistakes that athletes or first responders make when it comes to their health?
So it's too much, pushing too much without the recovery piece. So I know from a female aspect, for like the athletic world, chronically under eating, not even necessarily trying, but under eating is a huge stressor to the body. So anything that's going to cause additional stress, as like a professional athlete, like let's take a CrossFit athlete, for example, like their recovery is just as important, if not more important, than their training, right? The body has to have that recovery. So first responders, if they're pushing their bodies to the limit because they need to train for their job, but then their job's also stressful and home's also stressful, and they're not sleeping well, and they're not eating good food or not eating enough, it just adds up. So if we can focus on the foundational pieces, less stress at home, better sleep, what we're exposed to in terms of our exposures, proper nutrition, we can push our bodies, and the bodies can handle that more because we have that recovery aspect.
Okay, so recovery, kind of as I assumed that would be, and it's something that we hear a lot, and it's probably the first thing that most people dismiss
Mm-hmm.
because it's like, well, we always hear you got to work out, you got to do these things. And then you're at the end of a long day and you're just like, I don't want to spend any extra time doing anything else because I beat myself up today. And sometimes recovery isn't the most enjoyable or the most sexy thing because it doesn't give you necessarily the instant gratification. Once again, the quick fix. It doesn't give you the instant gratification that working out does. Because you just do it and you're like, well, I'm still sore or I'm still, this is still going on. But in reality, it's something that needs to be done long term and continued chronically to have an overall impact. Would you agree with that?
Agreed. And started sooner than later. I mean, we were CrossFitting at the same time. If I would have optimized my recovery in my 20s when I was a CrossFit athlete, I probably would be in a much better state now, close to 40, if I was taking that seriously when I didn't necessarily need to as much because I didn't feel it. So starting that before we feel like it's a big,
Yeah.
a big portion.
Okay, so let's talk about recovery and heart math a little bit. This came up in my last episode about how to potentially get into a mindfulness state. But what does heart math do in terms of recovery and allowing us to know if we are getting into that state?
So I can't speak super educated because I don't actually do the heart math patients, but I do have a health coach who does them. I have done heart math myself and it's been very helpful. I am a need to see it to believe it kind of girl. It's actually why I like testing. Like, sure, I know my cortisol is high. I get my cortisol test and I'm like, whoa, okay, I have to make some changes. Heart math is the other side where it's looking at heart rate variability, but it shows you real time. You put it on your ear and you're connected to this app essentially on your phone, real time of how much you're actually getting into that parasympathetic nervous system
Okay.
state. There's a lot of cool mindfulness stuff you can do while doing those, getting yourself to a place that you love, a good memory to help you get there. But it's really more, I don't know if you like that, but I know a lot of people who I treat like to have that like data. I want to see that something I'm doing is actually working.
Yeah, I think it's helpful in the sense that this is one notch the other way of, like we talked about with the instant gratification of working out. We don't typically see that with recovery, but when we start adding the wearables, the data to that, and I think it can be deceiving. Some people might be chasing the wrong things sometimes with the wearables and with the data that they're seeing. But with the right data and the right understanding of that, I think it can be very beneficial because you can actually see something working and happening.
Agreed. Yeah, I think people can become quite obsessed with the numbers and the data on wearables. And if you can use it as just that data, right, to see if a new supplement or a new bedtime routine or something you're doing is actually moving the needle, that's wonderful. It's great to see that change.
Because what are we looking for with heart rate variability? We
Num-
want that number to be bigger, right?
Right. Yep. Yes, we do. Yes, we do.
Okay. So, what uh, I would assume, being that you're a gut specialist, once again, you could tie everything back into that. And that's perfect because that's what people who are experts and specialize in certain things are typically able to do.
Hmm.
Is from my area of expertise, I can benefit this area of your life by making these adjustments. We struggle with sleep a lot in the first responder space, as I already mentioned, which is hard on our hormones, especially for men, testosterone. It affects so much. But what are some practical fixes that you typically tell people about for sleep?
Yeah, great question. Sleep is major for men and women, and testosterone, both men and women have, is a huge driver of sleep. So actually, it's unfortunately twofold. Like we don't sleep, testosterone goes down, testosterone helps with sleep. So it's very frustrating for people, of course, that work shift work. Practical stuff, again, it's the foundational stuff that's not, cool or, sexy. I keep using that term, but it's not this cool, big, overwhelming protocol. It is, having a consistent bedtime routine. It's not always easy in the first responder space to have a, consistent bedtime and wake time. So you have to kind of get around that. If you can, wonderful. But some sort of routine to do, the body really likes to have routine. So whether that is journaling, if you like, meditation, maybe that's a warm bath, maybe it's just like a herbal tea that you take to let the body know, like, okay, it's time to, rest and digest. It's time for our body to prepare for sleep. I will use supplements, really individualized supplements. I love magnesium. If we're having brain perseverations because we had a hard shift and we're constantly thinking about the cases we had to deal with, writing that down, brain dumping, but theanine is great. Those are all things I will use. I really like to dive into trouble falling asleep, trouble staying asleep, both really to kind of niche what people need.
Supplementation, uh, definitely not a bad thing because
Hmm.
as long as it's personalized, there's not a general one size fits all for everybody. And that's where we can lose people on that. So I would encourage you, if you're listening, like considering supplementation, talk to somebody who knows about it. And then obviously there should be potential testing associated with it and assessment so that you can actually be going after the right things and the right dosage. Second thing, weight gain and metabolism changes as we get older. And you already alluded to this a little bit, but when we don't eat, it stresses the body. And I think that is a big thing for people to lean towards when those changes start to happen. Because, I mean, I remember growing up, calorie deficits were always a big thing. And so it's like, well, I haven't changed that much except I'm getting older. And so maybe I just can't eat as much as I used to eat, or maybe I should just stop eating altogether. how much does that throw us off?
Yeah, so chronic stressors, again, it's all about how much stress we already have in life, but calorie deficits, low calorie diets, prolonged fasting is definitely a stressor to the body. Not always a bad one, right? This is why it should be individualized. If people are already overweight, obese, insulin resistant, that can be great. For people who are just like, "Ooh, I'm starting to pack on some pounds. I am a first responder. My sleep isn't great, but I'm also going to restrict myself with food." Probably not great, right? We need to optimize that food intake to make the body feel like, okay, I'm safe. Hormonal changes across the board are huge. I'm actually really pro hormones. I think they're really great if they're individualized and done appropriately. Our hormones do tend to shift as we age. Of course, the more stress we've been under, circadian rhythm changes as we age. That's only going to make it worse. So, optimizing cortisol the best we can and optimizing our not only reproductive hormones, but thyroid hormones obviously will have a huge impact on our body composition. And I'll say this till the day I die, resistance training, building muscle. Muscle is your organ of longevity. If there's anything you can do, make it less about the weight loss and more about the muscle gain. You're going to see body composition changes, metabolism improvement, bone health, optimized hormones, so many great pieces to that puzzle.
Okay. So anti-aging, well, you kind of just spoke to it a little bit, but anti-aging being very well aided by resistance training. When we look at VO2 max for people and we look at BMIs, like those are some of the highest indicators of decrease in lifespan overall. And so and when we do that resistance training, because all of our body systems plateau at a certain point in our life, right? They're all at different stages. But if we want to maintain that plateau instead of that sudden drop off, that's how we do it is with that resistance training. And because our muscles are what make that extend and create that longevity. Would you agree?
Absolutely. The resistance training, progressive overload, pushing yourself, right? Not just super easy weightlifting. And then the protein piece of it too, that goes back to the under eating, but making sure we're optimizing protein intake to feed the muscle or feed the recovery.
Okay. Three simple changes that somebody could make right now to improve their gut health.
So, first of all, I would change the way you eat. So, this is something I talk about all the time. This is kind of a multi number one, but things I tell people across the board all the time. These are my recommendations. You got to sit down to eat without distraction, right? That doesn't mean without like not eating with your buddies at the firehouse or your family, but no TVs or cell phones. I like people to actually gargle water or deep breathe before they eat. It actually sets that vagus nerve up, gets us into that rest and digest, prepares the body, right? Digestive juices start flowing. We're ready to eat. And then chew your stinking food. Nobody chews their food anymore. 15 to 20 times per bite. That's going to feel super uncomfortable for you if you've not been chewing your food. Those things alone will have a huge impact on how you digest your food, how you absorb your food, and how you have, any symptoms. The next thing I would say is just being mindful of the foods you're choosing the best you can, avoiding highly processed foods, mostly whole food diet. Organic, if you can. Not everybody can afford that. Groceries are outrageously expensive right now. So I know that's a huge frustration.
Yeah, you
There
can't
is
egg anybody's house anymore because eggs are ridiculous.
I know, it's crazy. It's so crazy. What we used to throw at people's toilet paper too, right? What we used
Yeah,
to throw at
yeah,
people's yeah.
exactly. COVID, but that was whew.
Yeah, fortune. Looking the EWG.org has a really good resource called The Dirty Dozen and Clean 15. I always ask people to use that resource if they cannot afford to buy everything organic. That's a really good resource of what should be for sure bought and organic. And then just being mindful of what you're cooking out of. So this goes into endocrine disruptors and hormones too, but avoiding plastics, trying not to cook your food in plastics. Proper cookware, stainless steel, cast iron would be really beneficial. Those would be three things that you can just change in terms of lifestyle. That's not a big, overwhelming protocol just to improve gut health and hormone health at the same time.
That was awesome, Lindsay. I ask that question a lot of times, and I always get really phenomenal answers, but that was very simple, practical things. And I know my listeners, who are a bunch of knuckle draggers, really enjoy simple, practical things. The gargling, I like that. Just limiting distractions, and that can probably be applied to many different times in our daily routine.
Mhm.
But talk to me a little bit more specifically about the chewing your food more than what we typically do. And I would assume we get into that habit just because of time. Time is everything to us. So we rush through. And first responders are terrible about this because we want to try and get our food in before the next call hits. But
For sure.
yeah, tell me a little bit about that and why
Yeah,
that's
I
so
feel that, in my bones. I don't even remember my meals truly as an ER nurse or a nurse practitioner. You just taking bites in between patients. So the body, is really naturally designed to have digestive juices to digest our food, right? If we're always in that sympathetic fight or flight, nervous system, it doesn't care. It's not going to, make digestive enzymes, hydrochloric acid, get our body ready. And so all those things matter, that sitting down to eat, trying to get us in that parasympathetic. I actually ask people to avoid liquids with their meals as well. So we're not diluting already, not having enough digestive juices. But the more we chew, digestion starts in the mouth. The more we chew, the more the digestive enzymes come out and the more we can digest and absorb our food. It's easier, of course, to just swallow, but you're not going to be breaking down the food. We're not going to be able to absorb it. We're going to cause some dysfunction, potentially some leaky gut that way, just by causing inflammation. And so really chewing is what sets us up for being able to digest and absorb our food.
okay. That awesome breakdown. I love that. Just very interesting to hear and get into that a little bit. What I was going to say earlier was you mentioned that some of maybe what you talk about might feel a little woo woo. Or it's funny, I've probably had about 3 speakers total on this podcast that have said similar things. And what I want to say to my listeners for that is, I mean, that has been something that has, maybe been stigma for that type of a thing. But now you're hearing that the recovery and that people are going to these things so much because it's not woo woo anymore. There is so much data and information behind this. So even though we still say that and it typically makes people smile and all those things, the reality is it's not woo woo, it's real.
For sure.
It's something that is truly beneficial and is different for everybody, and so I really encourage my listeners to be proactive with their health. Be an advocate for yourself and be proactive early. Like you said, we would have started doing some of these things when we were 25, our bodies might actually feel a little bit better at 40.
Yes.
So, okay, I don't know if this may be the best question, but you break it down how you want. Are there labs that people should be asking for when they want to optimize their health?
Yeah, I think, the conventional space really deters people from testing. I don't ever understand that. We have access to look comprehensively at patients, hormonal health, health in general, micronutrients. Like, why don't we utilize those things? I mean, we know why insurance doesn't want to cover them, blah, 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 the conventional model. But really, yes, I would say, especially when you're feeling great, not only when you're like, ooh, I don't feel very good, something must be off. Like, I wish all women and men got their comprehensive hormonal panels, including thyroid and, cardiac, all that stuff early on in life. So we know when you are starting to like, ooh, some things are changing, where you were at when you felt your best. I really like to look at people's hormonal panels, and I've said this, but reproductive hormones, I like full thyroid panels with antibodies to uncover any sort of inflammation or autoimmunity. If we're talking about prevention, looking at cardiovascular disease, I know you had Dr. Noonan on here before. I'm sure he hit on that big,
Yeah.
but that is an easy thing to grab, and we can make some huge shifts in people's lives and their mortality if we can look at it before it's an issue. I like to look at diabetic markers and, of course, micronutrients so we can supplement just as needed, not just, throw a bunch of supplements at people. I love looking at saliva cortisol as well, especially in my first responders or people who have done shift work. Really, I could say everybody who has stress because it's just so insightful into how that's impacting downstream all of our hormones. If you see a functional provider, I mean, you can get a pretty good panel for a couple of $100s. It doesn't have to be thousands and thousands of dollars to get this information. So I'd encourage people to ask their primary. If they won't, then seek out alternative care because somebody will want to look for you.
Yeah, Dr. Noonan and I have worked together in mainly one big project right now because yes, even him who's in kind of conventional medicine, he understands the need for a holistic vision of somebody from an early age. And so we're actually trying to do baseline CT angiograms on people because we should have baselines on people and we should see the whole picture because how much did we miss in that timeline if we wait until something actually comes up? So I would fully agree with you that I would encourage people early on. I mean, sometimes it might cost money because insurance doesn't cover everything, but go be an advocate for yourself. Go in, do testing, know for yourself. So that way, when you do have something that comes up unexpectedly, you have an understanding of where you're already at, and which will then actually aid all providers, whether they're conventional or functional, in assisting you in getting better.
Mhm.
So it will go a long ways across the board. So I really do like that. For listeners, someone who might be feeling a little bit lost in their health journey, what would you encourage the first step to be?
I think seek out, as you had said before, like please get advice from somebody who knows what they're talking about. I talk all the time about how cool it is that there's so much information education out there for people. On the same token, it's like overwhelming and concerning because what is going to help you as an individual, right? This influencer, that influencer, this supplement, who knows? So seek care from somebody who is trained. I used to be big on credentials, honestly, anymore. I'm like, ask people about what they've done, what their training has been, how they've helped people. But you have the power as the, person seeking care to interview your providers, right? Find somebody who aligns with you. I feel like there's always been this power struggle of like, well, they're the provider, they're the doctor, they're the NP, they know. Well, you get to decide too, right? Are they a good fit for you? Are they going to want to walk this journey with you? And then ask the questions, right? Like, these are the things I'm concerned about. This is my family history. But really, take your time, find somebody that aligns with you and your goals, somebody who will listen to you and is willing to walk with you on the journey, build that relationship.
Yeah, and potentially not just one person. This
For
is
sure.
my personal view,
Yes.
because the way that the approach that I'm trying to take is a holistic approach, but that should potentially include multiple experts that are on your side. Once again, I full-heartedly agree with you that it should be somebody that you click with, that is going to listen to you and understand you. But because we have gotten so specialized in so many different areas of healthcare, medicine, everything, a general provider is good because they have an overall picture of what's going on for you majority of the time. But I can tell you that a general provider does not have the same knowledge as a cardiologist when it comes to your cardiovascular health. So,
I couldn't agree more. Yeah, I mean, that's literally why I built the team I have with me too. Of course, it's not all inclusive. I refer to
yeah,
Dr. Noon all the time. We refer to each other. I have a functional dentist that I work really closely with. Like, I have the team I've built, but also my in-house team is here for that reason. A lot of times I say this often, you don't even need the provider. Like, if you want to just optimize lifestyle, hire a coach. Hire somebody who's going to keep you accountable, who knows what they're talking about to get you on this journey to optimal health before, you go under all this cool testing and do all these cool protocols. Like, that is not always necessary for people. So
yeah,
I couldn't agree with you more in terms of like that holistic team approach is huge.
yeah. I'll do a kickback to the episode that I just filmed last, because Dr. Shapiro was big on talking about taking care of you, putting yourself first. And that's just what you're saying with, like, just optimize, be, be the person that you need to be for yourself, show up for yourself. And that can look so many different ways. So start optimizing and seek help when you need it.
Hmm.
But yeah, you can do this on your own. But when something is off, I please go talk to somebody that has the expertise. And it is cool that you've created such a team, because it is nice. While I say experts and you need to see multiple people, it's nice when it's maybe all in one location.
Absolutely. Yes.
Yeah, there's a program down in Colorado that does this really well at one of the universities, and it's based around operator syndrome, so TBIs and whatnot. And from my understanding, they have what's called the fishbowl for anybody who's dealing with operator syndrome. And so they have 13 specialists that they will basically bring you in and sit you down. And instead of you telling that same story over and over again to each specialist individually, you tell your story to all 13 specialists at the same time. And then when you go for your different check-ins with these, they already have all of that.
Hmm.
So there's a lot of coordination and communication between those specialists. And it's a really cool approach. Obviously, that's, an extreme that can be hard to get
Yeah.
at some places. But yeah, these are the things that we should be looking at. So, okay, Lyndsy, we'll kind of wrap up for today, but how do listeners connect with Foundation Functional Med to get started on their own personalized health plan with you?
Yeah, we offer free discovery calls. I love to talk with people. This is again what I said before, like interview your provider, see if they're a good fit for you and vice versa. Not everybody is a great fit for our office either. So have that conversation. We offer free discovery calls. You can go online to our website, foundationfunctionalmedicine.com. You can schedule a call. We have multiple throughout the month, so it's not an issue getting in. If you're ready to take the leap, you can schedule with myself. I have a team of experts, like you said, behind me. I have health coaches that work with me, nutrition. I'm a breathwork practitioner. We have primary care in the office too. I felt that was a big need. So we work really collaboratively together. But start on our website. It links to our social medias. I'd love to connect with any of you interested in functional medicine.
Awesome. I really do hope that, not from a business standpoint, but just from a holistic optimization standpoint, that this sparks listeners not only in the Treasure Valley, but all over to look into functional medicine a little bit more, because there's a lot out there and this opens the door for so many things potentially. Anyway, thank you so much, Lyndsy, for your time today. It was awesome to get to catch up and to talk with you in this capacity. Maybe we'll do it again, do a part 2 and dive deeper.
I'd love that so much. Thanks for having me. It's great to see you.
All right. Take care.
You too.
That's it for this episode of the Forging Wellness Podcast. If you found value in today's conversation, please subscribe, leave a review, and share it with someone who could benefit. Your support keeps this mission going. Want to help us grow? Consider making a donation. Every bit helps us bring more impactful content your way. Follow us on Instagram at Forging Wellness 208 and check us out on YouTube. Thanks for being a part of the journey. Keep forging your wellness, and we'll see you next time.